Good afternoon and good evening, everyone, and welcome to today's session on communication during the COVID-19 pandemic. What can we learn and how to move forward? Today's session is the first session in celebration of European Public Health Week being held by the University of Nicosia Medical School. So we will welcome you at the end of this session and remind you that you can participate in the sessions that are occurring during the rest of the week. Today's session is being held by the University of Nicosia Medical School in collaboration with the Cyprus University of Technology. And we welcome you all. Thank you for joining us tonight. I'll point out that even though you can't see that there are other attendees in this session, we have more than 50 people registered and already about half of those are attending. So there are other people with you in this session. And in a little bit, I'll give you some thoughts about how this session will proceed. As a reminder, this session is being recorded, and the recording will be available after the session and posted on the University of Nicosia Medical School website. So today I have with me today some esteemed colleagues, both from the University of Nicosia Medical School and from the Cyprus University of Technology. My name is Maria Cecilia Mosquera. I am an assistant professor in the Department of Primary Care and Population at the University of Nicosia Medical School, and I'm very happy to be joining you here tonight. I will be the host for today's session. I'd like to introduce first Dr. Zoe Giannousi, who is an assistant professor in clinical communication at the University of Nicosia Medical School, and I'll allow her to please give us a brief introduction so you know who is here with us today. Dr. Giannousi.
Discussion today. My background is in health psychology, and I have joined the University of Nicosia Medical School the last couple of years as an assistant professor in clinical communication. Happy to teach communication skills for our students.
Thank you very much, Dr. Giannousi. We thank you for being here tonight. Next, I'd like to introduce another colleague from the University of Nicosia Medical School, Dr. Despo Ierodiakonou. Would you kindly introduce yourself to the
Good afternoon to everyone, and thank you, Maria Cecilia, for inviting us to join our forces for a healthier population. So I'm a general practitioner. I joined the University of Nicosia Medical School a few months ago, and I'm an assistant professor in primary care and population health. And my research interest is epidemiological and primary care research of common respiratory diseases, including asthma and COPD.
Thank you very much, Dr. Ierodiakonou, for your introduction and for joining us here tonight. Next, I'd like to introduce our third colleague from the University of Nicosia Medical School, Dr. Ourania Kolokotroni. Dr. Kolokotroni.
Good afternoon, everybody. Welcome to the European Public Health Week and the events organized by the University of Nicosia Medical School. My name is Ourania Kolokotroni. I'm a pediatrician, and I'm a clinical associate professor of epidemiology and public health and head of the Department of Primary Care and Population Health at the University of Nicosia Medical School.
Thank you very much, Dr. Kolokotroni. And now I'd like to proceed to welcome our esteemed colleagues from the Cyprus University of Technology. Dr. Nicos Middleton, would you kindly be able to introduce yourself to the group here?
Hi, everyone. Good evening, and thank you very much for the invitation and this excellent organization. Let's hope we're going to have a very interesting week. This is the first event of the week. I'm Nicos Middleton. I'm an associate professor in health sciences research methodology at the Department of Nursing, Cyprus University of Technology. I have training in public health, and my main interests are influenced by social epidemiology rather than clinical epidemiology. I'm not an expert in health communication. My interest in health communication, I'd say, in my 20-year experience in public health research started about 4 years ago as part of the Baby Buddy project here in Cyprus, where we had to establish an interdisciplinary collaboration with all the scientific associations here in Cyprus to develop evidence-based and best practice information advice for pregnancy and birth. Thank you very much.
Thank you very much, Dr. Middleton, and thank you again for joining us here tonight. And I would like to introduce next Dr. Andrie Panayiotou. Kindly, if you could please introduce yourself. Thank you very much.
Thank you, Maria Cecilia. It's a pleasure to be here today. I'm Andrie Panayiotou. I'm Associate Professor in Public Health at the Cyprus International Institute for Environmental and Public Health at the BAC. I'm an epidemiologist by training and a biologist, if you go further back. And my research interests are the epidemiology of atherosclerosis, the cardiorenal syndrome, and vascular aging. And since I'm last, I'd like to wish to all of us a happy and fruitful Public Health Week.
Thank you very much for your kind introduction, and to all of our panelists for joining us here tonight. We're looking forward to this conversation. As you can see, we have a wide and very interesting group of experts and speakers here today. So what I'm going to do is introduce you to what today's session will look like, just so you understand how it will flow. So we're doing the welcome now. We will proceed after that with an introduction to risk communication by Dr. Giannousi, and then presentations by Dr. Ierodiakonou and Dr. Middleton. After that, we're going to proceed to the question and answer session, in which all of our 5 panelists will participate, and then we will have our conclusion. So today's session will be 90 minutes, and I'd like to encourage you that you don't have to sit throughout these 90 minutes. Please feel free to stand, stretch, or move as you like. We as panelists will be sitting, but we encourage you to be moving. And as you have questions, please, throughout the presentations, we encourage you to write your questions, if you can, please, in the question and answer box, and not the chat box if you can, kindly. And what we'll do is, as the presentations are going, we will be holding on to your questions, and we will work to answer them once we reach the question and answer piece of our dialogue today after the presentation's finished. So please, as you have questions, please ask them. So we will proceed with our conversation today about communication during the COVID-19 pandemic with an idea of what we can learn about communication and how to move forward. This session is for health and public health students and professionals, and we aim to have an interesting dialogue about what is communication when it comes to health, and what are the pieces that we can learn from about what's been going on during this pandemic, and how can we as students and professionals take that moving forward into our careers, into the future, to help our patients and our community. So with this in mind, I would like to once again introduce Dr. Zoe Giannousi, who is going to give us an introduction into what is risk communication. Thank you, Dr. Giannousi. And I'm going to stop sharing. So
Thank you very much. I'm going to try and share. Give me 1 minute, please, just to share my screen. So today I'm going to speak to you. My presentation has to do mainly about risk communication. It's an introduction to our fruitful conversation for today, and it will be based on some basic principles of risk communication. So first of all, we would need to go through a brief definition of what is risk communication, and the dissemination of it has to do with the dissemination of information that are beneficial for decision making, positive behavior change, and maintenance of trust. All these are primarily considered or are risk communication. It is mainly a social approach rather than a technical approach like risk assessment or a political approach like risk management. Risk communication is basically a social approach. And 2 things are very important here. The first one is that the general public is the most relevant to this approach. And the second is that the mass media and social media play a key role in this social approach. At this point, I would like to mention that we should not forget that communication comes from the Latin word communicare, which means to share. More particularly, it has to do with sharing information, either between many people or between just 2 participants in a dialogue. So in the case of risk communication, we talk about sharing information about the risk. Communication capacities are required through 3 main phases: when we prepare for the risk, when we respond to the risk, and when we start the recovery phase from the risk. Risk communication is recognized as a two-way and multidirectional communication and engagement that helps actually the affected populations to take informed decisions to protect themselves and their loved ones. In other words, it is an interactive between the authorities and the public. Sorry about that. Risk communication during the COVID-19, the pandemic that has dramatically influenced our lives for more than a year, involves the news, involves official statements, coping strategies that we may have thought of or we may have employed, and medical conditions. What are the symptoms? What is the course of the disease? What are the death rates? And other kind of indices. And the main goal is to inform people in order to make decisions that could help them save their lives, their loved ones' lives, and their communities' lives. In this slide, I'm just presenting the basic aims of risk communication. And these are to raise awareness about the risk, to encourage protective behaviors, to build up knowledge on hazards and risks, to promote acceptance of risks and management measures, inform about protective behaviors, provide reassurance, meaning to reduce anxiety and manage emotional responses like anger and outrage, build trust, enhance cooperation between different kinds of stakeholders and between the people, build networks, and to encourage the mutual dialogue and understanding, but above all, involve all actors in decision making. What is really important is that the aims and their efficacy, the aims of the risk and their efficacy need to be measured, need to be assessed. And this assessment, the results of this assessment, need to be conveyed to the public regularly. They need to be monitored. Without monitoring and assessing of how the knowledge has changed, or if the behaviors have changed, or if there is acceptance of the new behaviors or of the new management measures that are implied by the authorities, all the activities related to risk can become mechanical, can become meaningless, and cannot help manage and control the public health emergency in discussion. So if we do not monitor the outcome, the risk communication wastes valuable resources, becomes ineffective, and creates a false sense of achievement. There are two complex issues that determine the success or failure of risk communication. The first one is the different perceptions of the same risks by experts and by the public. For the experts, the risk is great when the hazard is great. And in the case of COVID-19, for the experts, the risk has to do with how great is the chance of a population to be harmed by COVID-19. For the public, on the other hand, the risk is great when the sense of emotional engagement is great. So in the case of COVID-19, the risk has to do with how great is the chance of me or my loved ones to be harmed by COVID-19. Throughout our endeavor to cope with coronavirus, proper communication is essential to keep the morale high. So for this reason, we need to pay attention to some basic principles. First of all, it is not enough to consider only objective information. Risk communication is much more than epidemiological data. We need to pay a great deal of attention to perceptions of risk. Perceptions vary in individuals, vary both in experts and in the general public, and they can create problems and crises among people. Our effort should not be to change these perceptions, but to change the risks that these perceptions are based on. And also, we need to be consistent And the message should be the same across all people that are involved, across all stakeholders, public authorities, patients, people in companies, employees, or teachers or organizations. But most importantly, the aim of risk communication is to make the scientific definition of risk match with the public perception of risk. Therefore, when we communicate risk, we cannot ignore the perception of it. When there is a mismatch between these two, conflict appears, and usually we experience public anger, excessive fear, or even outrage. Another important element is to understand how risk is perceived and what are the basic factors that create these perceptions. Perception is always linked with two things, basically. There are some other things that I would like not to expand on today, but the two more important elements, most important factors that contribute to risk perception are familiarity and controllability. So we are not usually afraid of things that we are familiar with. Take, for example, the shopping we do at a grocery store. We may go and buy some products that we know that they can be affected by various kinds of pesticides. How often is it that we make a scientific risk assessment when we buy potatoes, for example? So with familiarity is one important thing, that we get used to risks and we eventually accept risk. The other thing is controllability. The risk depends on how much we feel that we have control over the behaviors or the activities that can prevent us from getting harmed. For example, how safe do we feel that the mask can prevent us from getting harmed from COVID when we use public transportation? This is an example of controllability. So familiarity and controllability should also always be taken into account when we communicate risk, because these factors can increase the public outrage and can even cause fear and anger.
Hello, everyone. As you may have noticed, we are just having some technical difficulties, so please bear with us for a moment. Dr. Giannousi hopefully will be joining with us in about 1 minute or so, and if she is unable to join us, then we'll go ahead and proceed with the next part of our presentation. But let's see if in 1 moment she's able to join us. Okay, everyone. In the interest of continuing this dialogue as we move forward, what we're going to go ahead and do is proceed with the next part of our presentations. And then if Dr. Giannousi joins us, the time allows, we'll allow her to finish pieces of her presentation. So next will be joining us is Dr. Despo Ierodiakonou, who introduced herself earlier. In this part of the dialogue today, what we'll be having is two presentations. The first one will be introducing some clinical concepts and considerations for us to consider, and the second part will be about public health concepts. So Dr. Ierodiakonou, the floor is yours. Thank you very much.
Thank you, Maria Cecilia. Let me share my screen in a minute. Half a minute. Okay. Thank you again for the invitation. And let me begin by stating that I have no conflict of interest to declare with this presentation. And I would like to begin this talk with summarizing the vital functions or roles of family doctors and every primary care provider during a pandemic. As a patient's first point of contact, primary care tends to identify a spike in COVID-19 earlier than emergency departments and can serve as a reliable indicator of underlying trends in community transmission. Moreover, while a small subset of patients with COVID-19 will inevitably require hospitalization, the majority will be seen first and solely by primary care because the majority of infected individuals experience only mild to moderate symptoms. Treating as many patients in the community as possible also removes strain from hospital system and reducing the risk of overwhelming hospital capacity. Prevention of spread is also a vital function of primary care providers who assist public health authorities with reinforcement of social distancing and wearing masks, but most importantly, they inform and assist COVID-19 cases and their close contacts regarding self-isolation, symptoms, and time of testing. Moreover, primary care providers are in a unique position of being able to individually pinpoint who in their practice is most vulnerable. So home and community care of non-pandemic illness of high demand is also part of their role. This is primarily to divert patients away from hospitals that are already stretched in terms of resources. Further, this presents vulnerable patients from risking exposure in hospital setting. Next, vaccination is another part of their role in a pandemic. While this process is coordinated by public health authorities, primary care can offer a built-in infrastructure for rapid distribution of vaccines, which you have seen in Cyprus being done already. Yet, due to longer standing rapport, patients may be more likely to receive the vaccine after discussion with their family physician. And this is where the most vital function of all comes in, which is to educate and communicate the aforementioned messages to patients and community. However, there are some barriers and challenges to being able to educate and communicate patients and community. Maybe the first and most important one is time limitations, with both keeping up to date with new evidence, recommendations, and best practices, but also being able to educate patients and communicate with community. Using telemedicine helped a lot during the pandemic in a form of telephone, video calls, and so on. However, it cannot replace the relationship built with a face-to-face contact with patients, especially if the provider have not received sufficient training. Another barrier may be the lack or not sufficient communication or miscommunication between public health agencies and primary care for sharing consistent messages with the community. Another challenge, or a challenge that I would like to share, is patients' personal worldviews, moral values, a perception of risk and resilience to misinformations that healthcare providers have to deal with. Also, a challenge has been the numerous media and social media messages which are shared with the community, of which the majority is focused on risk and restrictions rather than benefits. Finally, the biggest challenge of all, I think, that is patients' lack of trust in authorities, doctors, and their skepticism towards science. I'm sure many of us share the same view that people's fears will delay the national vaccination programs around the world. I guess our willingness to put a foreign substance into our body is highly dependent on trust. Some thoughts we have is, do we trust the vaccine? Do we trust those urging or requiring us to get the vaccine? Do we trust those developing it and their methods of testing? Do we trust what the vaccine will keep us? Do we trust that the vaccine will keep us safe and not make us sick? Do we trust those administering the vaccine and the environments in which it is offered? Do we trust pharmacovigilance? Are there any long-term side effects? These are all questions that have been addressed to primary care providers and not only. I would like to mention some factors that may drive lack of trust. And I would begin with inconsistency. Sharing health advice as our understanding of science evolves may be perceived as inconsistency. For example, first we said to the public COVID vaccines are safe, and then we said COVID vaccines may cause thrombosis and death. Another factor may be discordance. Providers may have different opinions or advice which are not always in accordance with recommendations by scientific societies or organizations or the government. For example, an individual obstetrician says to the patient, if you get the COVID-19 vaccine, you should postpone pregnancy for 3 months. However, the OB/GYN Society states COVID-19 vaccination is recommended for those planning pregnancy or if you're pregnant. Another factor that may play a role is the impact between stories, personal stories, and scientific evidence. Sometimes messages shared as personal stories can be difficult to overcome with scientific data. For instance, it's easier to empathize with the experience of just one person being harmed by vaccine than it is to empathize with the experience of the millions of humans whose health has already been protected by vaccines. False balance is another a factor to be considered. And what I mean by that is that when a story or news gives equal weight to two perspectives, patients may perceive them as being equally weighted and valid, leaving patients to decide for themselves which is true. The following statement actually has these two characteristics, provides two perspectives. There's currently no evidence that any vaccine, including COVID-19 vaccine, causes infertility. And in the same statement, the author said, like all vaccines, scientists are studying COVID-19 vaccines for side effects. So in that scenario, the patient may actually weight the uncertainty more than the evidence. This is an example of false balance that may occur. People actually act when they trust the messenger, the message, and their motivations. If a messenger appears to be motivated by factors that conflict with the recipients or patients' morals, value, and worldviews, then the recipients of the messages won't trust the messenger. For example, if a patient has the belief that coronavirus was spread by pharma industry in order to make profit from vaccines, when you provide an information, you better avoid referring to statements made by pharma, EMA, or Food and Drug Agency, but rather try to share information or statements by World Health Organization, CDC, ECDC, NHS, and so on. Anyway, most likely they all agree. Timing also matters. People are most likely to trust and stick to the version of information they hear first. So there's a window of opportunity to get them the information and build trust. Finally, another factor that plays a role is the role model. I'm sure you heard the following question from many people. So they ask, if not all doctors and nurses are getting the vaccine, why should I? So how to overcome these communication barriers? How can we build trust with our patients or the community? First of all, we should make our content concrete and to supply facts. We can do that by remaining up to date with scientific evidence and recommendations. We should also have trustful resources ready in hand to share with our patients in person or via social platforms and messages, including public health material, fact sheets, or videos explaining the safety, how the vaccines work, and what efficacy they have. However, it is tempting to think that if we simply share consistent information about availability and efficacy of the vaccine, people will trust the information and behave accordingly. However, this is not what happens in real life. I'm afraid there are many more to be done. We should take patients' views and beliefs into account and make sure that we remain calm and persistent, as we may have to or need to repeat the same messages multiple times to the same or several individuals. We should also situate facts positively to make them believable and relevant. For example, we may choose to share positive stories of individuals reclaiming control of their lives after vaccination, or stories of susceptible people, elderly people being affected but remaining asymptomatic because of vaccination. In other words, rather than investing time into messages to try to convince people otherwise, it's worthwhile to understand what others see as right and wrong and to connect with what's most important to them. Find the common ground between what we hope to achieve and what matters to them. As I mentioned, speed is important, but so is consistency. And we should repeat, while being first with a message is important, it's also important that people continue to hear the same message from a variety of sources. Consider what else is happening at the same time and how that might affect how much people trust your message. Engage in listening on social platforms and people's conversations, where actually there is people's concerns are shared about vaccines. Understanding the reasons behind people's skepticism will help you design messages that overcome them. Make sure to be honest and communicate risk effectively. Be explicit and transparent about your motivations, and do not refuse the potential of risks or uncertainties, but communicate that effectively. Use definitions and details rather than acronyms and jargon. For example, if you're talking about the status of a vaccine trial, instead of saying a vaccine is in phase 3, say the vaccine has been tested on X thousands of people. Explain numbers in a simple way that anybody can understand, and another advice is to use absolute risk rather than relative risk. For example, instead of stating that if you take the medicine or if you get the vaccine, you have doubled the risk of this adverse event, compare actually the risk in the groups. If your chance of having an adverse event is 1 in a million in one group and 2 in a million in the other group, still, actually the risk is extremely low. So instead of mentioning double the risk, actually present the absolute numbers and clarify that this risk is extremely tiny. You can also discuss risk compared to benefit, and this is really vital, and use visual aids. So remember, if you can explain it simply, you don't understand it well. Sorry. So I chose to share the risk of blood clots and COVID-19 vaccines as an example. So we know that the risk of blood clots is 1 per million of AstraZeneca or Johnson & Johnson or adenovirus COVID-19 vaccinations. This can cause fear to your patient or to the public you're sharing information with. So instead of only stating that, you can actually try to put this information into perspective compared to other daily risks that we have in our lives around us. So if 1 per million is the risk after vaccination, actually it's a good idea to share what is the risk of blood clots in the general population, which is actually 1,000 times more. Even in a young patient, it's 100 in a million annually. So this may work to make the recipient of your message to understand the size of the risk. Ben Chan, an assistant professor of global health at the University of Toronto, said that chances of getting blood clots from the AstraZeneca vaccine are equivalent to the risk of being hit by a car and die in Toronto in a given year. So this is actually a way to put things into perspective and help patients understand what's the risk and how big is that risk. On the left-hand side here, we have a visual aid where we can help the patient understand the risk and the benefit and weights the two. What's the balance between the two? This figure has been made by the European Medical Agency. And on the left, with the blue squares, we see the deaths prevented after the first dose per 1,000 people getting the vaccine. And on the right-hand side with the red squares, we see the number of blood clots after in 100,000 people who get the vaccine, the first dose. So here, actually, we have some additional help to show to the patient that nearly for every age group, the benefit is much larger than the risk. In addition, there's, again, an assistant professor from Toronto who actually presented the numbers and showing that delaying vaccination by 2 to 3 days in Toronto actually increases the risk of death. So in other words, he showed that delaying the vaccination just a few days exposes the patients to a risk of death that is greater than the risk of blood clots due to the vaccine. Okay, so the bottom line is that we should urge everyone to take the first available vaccine and clarify that if they decide to wait, this may actually increase their risk of death by the virus itself and not by the vaccine. So before wrapping up, I would like also to point another important factor that help us communicate with our patients. We should evoke the right emotions. We should avoid using shame, fear, or sadness in calls to action. We better tap into hope, pride, and parental love to motivate people to act and affirm their positive sense of self. For example, we can state that vaccination is an opportunity to protect yourself and your loved ones and gain control of your life. Or another way to put that is just by saying, protect your family, protect your loved ones, help the world get past this crisis. This may have a better impact instead of saying, oh, if you don't get the vaccine, you have chances of dying, and so on, so on, so. Finally, I would like to emphasize that we have to emphasize that patients and the public have choice and freedom. Vaccination is an opportunity and a choice, and no one will be forced to get the vaccine. So we should respect our patient's choice and remember to repeat and state the benefits of getting the vaccine and share these benefits, not simply in the form of data, but to tell stories of people who have gotten vaccines, stayed healthy, and reclaimed their freedom to pursue their favorite activities. And thank you for your attention.
Thank you very much, Dr. Ierodiakonou, for your very interesting presentation. And you've highlighted the key role that clinicians have to play in this pandemic to educate and communicate, and share with us what some of the barriers are, including time limitations, people's perceptions, inconsistency and discordance. And thank you for highlighting some of the things that we can actually do as clinicians to try to find a common ground and create consistency and have those messages be what we need them to be from the clinical realm. So thank you very much. What I will do is I will encourage our audience to write questions in the Q&A box, because after our next presentation, we will be working to answer your questions. So please, as you have questions or comments or thoughts, please put them in the Q&A box. And what we'll do now is proceed to our second presenter of this piece after the initial introduction to risk communication, who is Dr. Nicos Middleton, who will be giving us some insight into the public health realm when we think about communication. So Dr. Middleton, the floor is all yours. Thank you very much.
Thank you very much, Maria Cecilia. So I can assume that you can hear me. Well, okay, let's move to the population level and public health messaging. Before I start, let me make clear that I have no intention to criticize the public health response to the pandemic by the authorities or the participation of the public in this response. Any examples I bring up represent my own personal views, and therefore the sole purpose of elaborating on some ideas and thoughts around health communication at the public health level. Due to time restrictions, there was many examples to choose from, or lack of examples to choose from in the case of Cyprus. But due to time restrictions, I will focus only on the topic of masks. Other than being more visual, so I thought it's more appropriate for this, for the purposes of this talk. Beyond that, what guided my choice really is, as I'm sure you will probably agree, masks have been a symbol of this pandemic in so many ways, and not just a visual symbol. I don't know how many of you have seen the CNN piece. A mask says a lot about the person who wears it, but even more about the person who doesn't. And of course, getting rid of masks also carries enormous symbolism. This is Biden and Harris celebrating with other people at the White House this past Friday, after the CDC in the US changed its recommendations that vaccinated people no longer need to wear masks, raising questions as to whether masks can again be a symbol of unity or a symbol of social division. I want to start by saying this. A couple of years ago, when there was carefree travel, I was at the European Public Health Conference in Slovenia. And the most memorable plenary session for me was one on health communication. And it wasn't by a public health expert. It was by the creative director of a marketing company who analyzed very eloquently why public health messages and health promotion efforts are not as successful as we would like. Because we try to educate, failing to grasp people's attention and imagination. Our brain was made for 3-second attention, but our minds were made for stories. That's the challenge, communicating non-fictional stories with facts, public health evidence, and recommendations, yet in the form of a story, is quite challenging. At the beginning of the pandemic, during the first lockdown, my 8-year-old son created a story for a school project. And I have to say, it was the most useful thing, the most useful school project they've done in a year. It was actually a short animation film called Think of Others. It featured an elderly man sitting alone at home for hours on end, watching the news, getting worried about the pandemic, and waiting for the next morning to go to the shops, only to find the shelves empty. Yet on his way home, the very little that he found to buy, he would share with this young girl who waved and said hello to him every morning from her house window. Well, at the same time that my son was making this story, a Lancet editorial referred to the enormous displays of prosocial behaviors that this pandemic triggered around the world, with neighbors coming together to the aid of those who needed it. And I'm sure these acts of kindness occurred across Cypriot neighborhoods as well. I'm just not aware of the extent to which it happened. And of course, there was very commendable action from several organizations and institutions in the community. So is prosocial the way to go? How do you get people to participate on an enormous global scale to the virus containment efforts? Do you emphasize the need to protect themselves and their loved ones, their family? Or is this about protecting others, the wider community, the greater good? Well, the truth is there has been several studies which tested under a prosocial message whether conditions, whether something like that would be more effective in influencing people's intentions, attitudes, adherence to measures. And the truth is the results are very mixed. So what is the story? What has the story been? Or rather, what will the story be when all this is over? Well, I guess there can never be one story. It's more like those adventure books that my kids love so much, where you choose how the story continues. If you want this to happen, move to page 27. But one of the reasons, these books are so successful is because the author anticipates how the readers might want the story to evolve, with twists and turns, but around a strong core to the story and appealing characters in the story. Well, similarly, public health communication campaigns need to know their audience. They need to prepare, they need to test, and they need to anticipate. In general, we'd say that public health communication campaigns try to influence knowledge, beliefs, attitudes, but mainly, ultimately, behaviors. They might not be as successful, especially if they're standalone, but they can contribute in framing the topic, in shaping social norms, in setting the agenda, in cultivating public opinion that is more conducive to change, especially then in collaboration with health professionals in the clinical setting. But to be appealing, they have to capture minds, and they need to have cognitive and emotional appeal. And of course, they have to counteract noise. And I guess there hasn't historically been a better example of noise from cluttered and fractured media. Are public health campaigns ever successful? Well, the evidence is mixed, really. As I already said, not standalone. They have to be followed by other programs and policies. It's true, they're very socioculturally specific, they're very topic specific, and by default, methodologically, it is very difficult to draw causal connections and attribute any change to beliefs, to attitudes, to behavior, to a public health campaign. But beyond whether they're successful, beyond whether their effectiveness, we shouldn't forget that they serve a very important ritualistic purpose, because ultimately they are about values, they are about who we are, what we stand for. They reflect humans as members of a social community. They serve as a symbolic exchange of shared meanings. What is a mask? Well, a lot has been written about health communication during COVID, but if I had to choose one reference to suggest, it would have to be the resources and the toolkits of the Tell Me partnership. This preceded the COVID pandemic, and it is specific to communication during epidemics. The authors list a list of challenges in communications that they identified in these situations, which of course they exacerbate in emergency situations. I'm just going to read through them, and I'm going to let you think of whether, with no commentary, I'm just going to let you think of whether we observe something similar here in Cyprus. Well, generally, there is absence of an overall communication strategy. There is a tendency not to communicate, or the opposite, to communicate too much. We tend to assume that the audience is passive and homogeneous. We tend to put a negative framing in our communication rather than a positive one. There is confusion of roles and responsibilities. There's different views and opinions even amongst the scientific community. There is a lot of noise, a lot of it coming from the media. There's no bidirectional relationship with the media. We are not proactive in the spread of misinformation or disinformation. And generally, we tend to regress back to a just listen to the expert approach. The core function of a communication campaign at the public health level has to strike is to strike a chord, and it has to strike a chord cognitively and emotionally. It has to have an emotional appeal. Well, what works in one situation or in one setting might not work in another situation or setting. Several styles of communication have been tested, have been classified based on their emotional appeal. Some focus on a sense of duty, but they tend to be paternalistic and create feelings of guilt. Others try to avoid guilt, appealing more to rational reasoning, so they simply share information. Others try to focus on the consequences of a behavior, and they might even employ fear and display human vulnerability to a situation. Others try to portray consequences, but in a more light, in a more gentle, in a more indirect way, sometimes even using humor to do so, because arousing fear very often backfires. And lastly, others try to be reassuring, to affect positive emotions instead of negative emotions, to promote a sense of control, a sense of self-efficacy. We can do this, which we know that is at the core of behavior change. I'm sharing some interesting videos, both from the UK, one evoking fear, the other one using humor to pass on a message. I guess in the past 15 months, we have seen the full range, and in fact, many hybrids, as it is a great balancing act to imply consequences without fear. It's a great balancing act to evoke a sense of duty without making people feel guilty. Well, these are some examples from all over the world. This summer, wear a mask, don't accidentally kill anyone, accompanied by images of people in the ICU, look her in the eyes and tell her you never bend the rules. Some others are simply informative with a light pro-social message. My mask protects you, your mask protects me. Or this infographic display of the risk of transmission when people are wearing or are not wearing masks. Others go a different way, that don't highlight the pro-social aspect at all, but the personal safety aspect. Stay safe, wear a mask. Or this one that I personally don't understand. Heroes don't wear capes, they wear masks, which might inadvertently highlight the burden of wearing a mask, equating it with some heroic act rather than a compassionate, a kind act, one of humility towards others. Others go the full pro-social approach, and they try to highlight values. I wear my mask for humility, for kindness. Or this one from an association of churches, interestingly enough, in the US, appealing to the Christian value of loving one's neighbor. And then there comes this one from Cyprus, which in a way it reprimands people for wearing the mask wrongly, while trying to use humor, I guess, in the meanwhile. But in a way, it might moderately exacerbate the social norm. After all, come on, we've all seen it, we have all done it, probably for different reasons or different motives. Of course, this was not the only campaign material from Cyprus. Subsequently, there was a video and banners. You must have seen them in the highways or in other spots, featuring famous people, the president himself, asking people to wear a mask. And much later, perhaps a bit too late, one might say, there was another one featuring members of the advisory committee and citizens, this time with a message that wearing a mask is rather a simple thing to do. As I said, perhaps this came a little bit too late. The truth is, it's not easy to capture the right message in 200 characters in a 30-second video, and certainly not when this doesn't happen in a void. Well, I don't really want to get into the role of the media, the social media, our everyday conversations and exchanges with other people for that matter. But it is certainly an unequal battle. And very often the damage, if I can call it that, it is perhaps unintentional. For example, announcing mask mandates, but in press conferences where people are not wearing masks. Newspaper articles that focusing too much on the huge confusion as to when and where we have to wear a mask, or news articles saying that the president of the country is actually pleading with young people to adhere to measures, pretty much highlighting that this is the norm. Young people do not wear masks. How do you best use your 30 seconds of video then? Well, it's not an easy decision to make. Do we wear a mask for others, or do we wear a mask to be able to continue doing the things we love with others? And I'm pointing to a very similar little video, for all the things we love, wear a mask, from the American Hospital Associations, that you can see in your free time. A simple model to go by, I guess, is the what, so what, now what? If we see what the Cypriot campaign is actually asking people to do, it says, I wear a mask, which is the what? It's the expected, the suggested behavior. But is this unambiguous? Is this specific? Why do we wear a mask? When do we wear a mask? All the time, or in the presence of others? When you see someone, do not reach for the hand, reach for the mask. So what? Why? For a brighter future? Well, it strikes an optimistic tone, but it's quite a distal outcome, which doesn't really focus on people's everyday life. It continues for our children, for those we love, for those who raised us, a clear pro-social message. But there is no verb. Is it to protect them? Is it because we want to be able to continue meeting them and do things with them? Is it to set a good example to our children? Is it to stop the spread? All of the above. We are part of the solution, not the problem. So now what? It sounds like a call to participate, but someone might also read it as a choice to be naughty or nice, a social divide between us and them, those who adhere and those who do not adhere. It might have worked. I don't know. I haven't got any evidence whether it contributed positively or not. Again, a lot has been written about how do you appeal to the public with a pro-social message. Well, the main thing is that you need to highlight the benefits to the community, if that's the approach you're going to take, that this is a choice, a personal choice, but it is for the public good. And truth is, we've seen, other than the masks, a lot of the hashtags that we've been using in Cyprus don't really do that. Stay home, stay safe. Why not stay home, keep others safe? We will get through this together. Why not we will get through this, rather than we will get through this together. The second aspect of a real pro-social campaign is to show the norms. People want to feel that they're doing what other people are doing. And you can show that not by focusing on non-adherence to measures, but to adherence to measures, that people are actually, this is what they are doing, and they know that this is the right thing to do. But more importantly, identity framing. Why are we doing it? Who do we want to be? Is it because we are compassionate? Is it because we are kind? Is it because we're patriotic and we want our country to get out of the pandemic faster? What is it? There's, of course, many more. Is it a story that people can relate to? Is the importance of the message coming through for everybody? One size doesn't fit all. Do we have to tailor the message? Who should the messengers be? Should it be famous people, celebrities, politicians? Should it be representatives of the public? Who is doing this campaign? The Ministry of Health. Who are the partners? Who else is supporting this campaign? Who are the stakeholders? Who are the community leaders that are going to spread the message further? What is the context and the format in which this campaign was delivered? Did it have presence? Should it be against a white background or showing people in their everyday lives? If you remove the mask, I'd say it reminds me of a lot of the posters we see in the election period. Is that enough? One-off? Should there be a follow-up to build up the conversation? Most importantly, I left the most important aspect for the end. Is it theory driven and is it research informed? There is many behavioral change theories, many health promotion theories, and most of them are, well, they're different, but they share common aspects. People don't just want to know why they're doing something. They want to feel that they're able to do it, that they can take control in this situation. They need to know that they're able to control this behavior that we're asking them to do. Norms are important, social norms, to know how to deal with social influences. I'm sure everybody's been in a situation where somebody asked us, why are you wearing a mask? Is it because you're afraid? We need to know what to respond. No, it's because of this. What is exactly the thing that is going to motivate people? Motivation is a big part of behavior. We need to strike the right emotion. We need to strike the right identity. So we need to research it. We need to know what is exactly the thing that is going to motivate people. Are we promoting the identity of social responsibility? Then perhaps images and voices of those we are trying to protect would be the way to go. Are we trying to promote a sense of the need for collective action? Then partnerships, community leaders, perhaps is the way to go. Are we trying to promote a group culture? Then accounts of adherence is important. Testimonials of how people are doing it and coping with it and why they're actually doing it, who they're doing it for, might be important. I want to turn our attention very quickly to a different communication campaign. As I said, I don't want to make comparisons, but this really is different. I'm not suggesting that the success of New Zealand in containing the virus is down to the communication campaign. We all know that this country had very strict travel restrictions and so on, but it really stands out in many ways. It tries to activate positive emotions. It calls people to unite against the threat. It has a clear pro-social framing. We're doing it for each other. As you can see, it's not even using the word mask. It's actually using the function of the mask. What does a mask do? It covers our mouth and our nose because this is a respiratory virus, and we're covering in the presence of others to protect them. Who features? Everybody, young people, old people, from all backgrounds, from all walks of life, because this concerns everybody. And in a way, it's a call to participate. It's telling people we can all do it together. This is about taking control of the situation. So now the conversation will not be whether mask protects you a lot or little, but it's more about the product it promotes. It doesn't promote the mask. It promotes being part of a community. There is a long tradition in social epidemiology about what matters in times of crisis, and that's preserving social cohesion, because two forces are getting out of balance: social control and social integration. To put it simply, when we feel that we're not part of a community, that we don't have a common purpose, we might resort to individualistic behaviors. We might reject any need for social control. So is this pandemic bringing us together, or is it tearing us apart? Well, there is some studies that show that we might be thinking we're coming together, but not quite. Social cohesion, for example, in England is at the lowest level that it's been since pre-pandemic years. So is the New Zealand approach working? Well, I can't really tell, but there is an interesting study that I came across that suggests that if we compare over 800,000 tweets from English-speaking countries, the New Zealand tweets stand out. Other than the fact that they are the ones that put the greatest attention to protective measures, non-pharmacological interventions, they tend to be more calm, more accepting, emphasizing empathy and kindness. I guess we wouldn't be surprised, because be kind was the main message of the New Zealand communication strategy. But I guess it wasn't even a communication strategy. It wasn't just a communication campaign. It was a brand. It was a platform that was branded as a single source of truth. It didn't focus on fear. It focused on a call to participate, to team spirit. If you consider it's not even focused on the virus, it's probably some of the only leaflets that I've seen from around the world that don't even portray the virus itself. It tells people what to do and why, and not what not to do. It keeps people alert, but keeps reassuring people that their action matters and it makes a difference. And I guess the creators of the campaign, you can go find this article in The Guardian. They gave an interview and they explained what was behind their whole approach. They wanted to be clear about who they are, the identity that they're trying to promote. They weren't trying to tell people off or make them feel guilty. They chose a completely triggering positive emotions because negative emotions are not an effective influence on behavior. Just to wrap up, I guess this summarizes a lot of the things I said, but in a more organized way. If you want to be successful in a public health campaign, of course, you have to be technically accurate in the information you're giving, but you can't go about doing it alone. You need to coordinate with partners. Of course, you need to be, information has to be timely, it has to be at the right time, not too late. But it can't be one-off. You have to keep on building the conversation. You have to ensure presence, that this information is not just on a motorway. It has to be, you have to coordinate with stakeholders, and you have to ensure accessibility. You have to listen to the audience, not just talk to the audience. You have to hear people's experiences, concerns, because the message has to resonate, it has to be relevant to them. And the best way to do this is to actually tell real stories of real people and how they're coping and how that can empower other people to do the same. And lastly, it has to be based on research evidence, and it has to be theory driven on what exactly is going to affect behavior. Thank you very much, and I hope I didn't take a lot of the time because I can't really see.
Thank you very much, Dr. Middleton.
What time it is?
Yeah, no, for your very interesting presentation. It's important that you've highlighted for us some of the public health considerations and gave the example of masks, understanding that there are so many examples that could have been discussed. So thank you for going through some of the insights into what the pro-social behavior might be and some of the stories that sort of come into play with this. And for sharing some resources that highlight the common challenges and styles as well of in-health communication. And for reminding us that it really is important for us to think about even communication to be theory-driven and research-informed. And reminding us that we sit within a world where we will have to collaborate and coordinate our messages and responses. So thank you very much for your time and for your presentation. We will actually now move forward to our question and answer session. And for that, what I will do is I will share my screen. As I've mentioned to you all earlier, please feel free to list your questions. I encourage you to do so in the question and answer piece. And what I'll do is we'll go through some of the questions. I'm just looking right now to see, I think we have a couple of them. And please write them in the question and answer box and not the chat box if you can. But before we get to the questions, I wanted to give you some food for thought. We've been talking about communication and health, particularly during the COVID-19 pandemic, and we haven't had the opportunity to focus specifically on written communications. So what I'd like to do while we start to answer some of the questions from the audience is just to put this image on the screen of what a written communication has looked like, and what's one example of a written communication in Cyprus. It's specifically about the AstraZeneca vaccine and their general instructions for the public. This is the first page of that written communication piece. So as we're talking, take a look at this, think about some of the principles and concepts that have been highlighted by our three speakers, and see what you think about when we talk about communication and health. So I'll keep this on the screen. And what we'll do now is we have a couple of questions. And I do have one question that is related to vaccines that one of our audience members has asked. I will read that question specifically, and then I'll allow our panel members to chime in. They can feel free to turn on their camera and unmute themselves as they like. So let me start with the first question that was shared by our audience. And I would ask, I think, all of our panelists, if you haven't turned on your cameras, to do so now. So the first question that was asked by our audience is, what is the future of vaccine effects over human psychology? That is the first question that was asked, and I'll take that to say that we're in the image that we're sharing now. We have given an example of what a vaccine communication might be, and perhaps we can talk about it as a panel, tie in the question that the audience member has asked to what written communications might be related to vaccines and what some of the outcomes are that are of consideration to us. So I'll open that to our panel, and we'll see who would like to share their thoughts first.
Shall I go first?
Please go ahead.
Okay. So what are we looking at? It looks very similar to what people get when they're actually already at the vaccination center. So in which case, I would say that this is not very timely. If you're already at the vaccination center, you made your decision to go get vaccinated. This is information that should be provided beforehand. And I guess I should have started by saying that written communication is actually the bridge between public health level and clinical levels. It's something the doctor could have and hand out to the people visiting the clinic. So it's not very timely. In terms of communication principles, I'd say the first thing that comes to mind is that it's not very easy to look at. There is an issue with structure. The good thing about it is that it does try to cover the 4 dimensions of concerns that people might have about vaccine. It does refer to effectiveness. It does refer to safety and side effects. It does refer to what people might need to know. I'm not entirely sure, though, that the language that is used is positive, strikes a positive tone.
Can I also kind of share my thoughts? I mean, I agree with what Nicos has already said. I think, and tying it in with the question that we had from the audience, I think people are also worried about long-term side effects of the vaccines. They all know what the immediate side effects might be, and these are the common side effects. But I think if we're looking at what information might be missing from this particular leaflet, is information about vaccine safety in general, because I think people's perception is that this is a new vaccine that hasn't been tested enough and that there might be long-term side effects that we don't know about. But what people do not realize is that we have been using vaccines for a very long period of time. And we have introduced new vaccines in the past we know what could be long-term side effects, and we know about vaccine safety. So I think the long-term vaccine safety, it's something that people are worried about, and they don't get information, obviously, from this particular leaflet. The other thing that I wanted to say in terms of health communication is that it kind of says that it reduces the possibility of an individual becoming seriously ill, but it doesn't give them any numbers. Sometimes people like or dislike numbers, but sometimes if you give them some kind of, how much does it reduce my risk of becoming ill, and is more specific information, then it might convince more people to take up the vaccine. Obviously, this is something that they sometimes given after people take the vaccine, and Nicos is right that it doesn't come in timely. But for people who are still making up their mind, I think it's better if, and I think the ministry has already given out a different leaflet that puts this in terms of numbers, the efficacy of the vaccine.
Can I?
Yeah, please go ahead. Thank you.
Can I also add, I totally agree with Dr. Kolokotroni and Dr. Middleton, especially about the visual. It does appear like a formal communication, not something that's addressed to the public. And while it's trying to address the issues of safety and effectiveness that are obviously worrying a lot of the population, I'm not sure it does so effectively, because it doesn't, in fact, for some people, it might even feel that it exacerbates their worries, because it states that there are some people, there's still risk. And another thing I wanted to point out is that even after vaccination, the person must continue to apply usual practices. So if my everyday life will continue to be the same, even after vaccination, it doesn't really address motivation for people to get vaccinated, which was the centerfold of the whatever campaign we had on vaccination, get your life back. But if I'm still obliged to do all of those things, then I'm not getting my life back. So that might be confusing, or it doesn't highlight the necessity of vaccination in a sense.
If I may, so I fully agree with Andrie and the rest of the panel group. Actually, this is a good example of false balance indicated here. So first, this states that, okay, you got the vaccine, you reduce your risk of contacting the virus. And the next statement is that, okay, but you're not completely protected. Basically, actually allows the person who has just been vaccinated to increase his fear again. I mean, he made a decision for the right or wrong reason to go and get the vaccine. And then after that, actually, we go back and increase the fear. So again, we lose, in a sense, the trust. I suppose that the point here was to make sure that those who had the vaccine should keep their social distancing measure and hygiene measures. But another way to put that there was that, okay, this is the first step going back to normality. Make sure you keep hygiene practices and keep your social distancing for a little bit longer, and we'll make it. I mean, that's another way to put this message there, but in a positive way, without actually making the receiver to balance on the wrong direction his emotions and trust.
Actually, if I'm allowed to just add on that point, I totally agree with Despo. And if we compare similar leaflets that I've seen from elsewhere, it's exactly that point. That the point to make is vaccination is yet one more tool alongside everything else that we need to fight this pandemic. Whereas in Cyprus, we build up the conversation that vaccination is the only tool, and then suddenly you see a leaflet with bold, let me say. So Despo is right that it turns out this is not general instructions. This is actually the point of this leaflet, to tell people that don't feel a false sense of security now that you're vaccinated, because you must continue to apply the usual practices. But I want to bring a new perspective as well. When we look at written communication, other than the understandability of it, what is actually trying to tell us, the other big aspect is the actionability of what is actually telling us to do. This is just information. It's not actually telling us to do something. The only aspect with actionability is the 1, 2, 3 at the end, which actually wants the recipient to know that after they need to come for their second vaccination. And in fact, they present it like steps, even though number 2 is not a step, is actually the title. Before you leave, book a second appointment. 2, remember to take your vaccination card. More importantly, every written communication has to provide informed decision making. So it's a good practice to actually point to a website somewhere that someone can find more information if they want to. of course, we already said this is not timely. It's given at the vaccination center and not earlier on. And it has to always support the healthcare provider and service user relationship. It has to say, feel free, talk to your doctor, call them, answer any questions you may have. And this doesn't appear anywhere. It's like the doctor is absent from this conversation.
Thank you all for your thoughts and comments. I'll say that we actually have one more question, and it happens to be a good one that we can use to wrap up our conversation, acknowledging that it's already 7:22. So I'll read out the question for the panelists to contemplate, and it says, what are lessons learned from public health communication? If you were working at the WHO or the CDC and could go back in time, how would you change a message and/or story? So what are our lessons learned as we wrap up this conversation? And if those of the panel that would like to chime in, maybe just give one thought to share to help wrap up this conversation.
I think my main thought would be what Nicos and Despo said earlier, that we should have included all the partners in the communication and make sure that there's a single message that goes across with all the partners in agreement. I think that would be one of the main things moving forward for myself.
Thank you. Other thoughts?
Yeah, go ahead, Andrie. Yeah, sure.
Thank you, Despo. I agree. I think CDC, although responded very well, the one thing that perhaps didn't do as well was the communication. It didn't necessarily have a consistent message from the beginning. Even though information was coming in as we went along in a new pandemic, it didn't show consistency in the message, that we're not just changing our minds about masks now, tomorrow no masks. It failed to show consistency of the message, that we're not changing our minds. We're adding information as it's coming along. And I think another factor that probably changed, and in Cyprus as well, is the two-directional approach of health communication. I don't think there was a lot of listening to the public and bringing that into the conversation. So it was more of a one-directional information towards the public, but not addressing not listening to what the people were asking, perhaps.
Thank you for your thoughts. Would anybody else like to share?
If I may ask, apologies for this problem I had with the connection earlier. I had to move actually from the office to home so that I can connect back. Apart from the consistency to all partners that was already mentioned, I think that what is really important to improve is the basic epidemiological and objective data to be communicated in a way that takes into consideration people's concerns, and also the assessment of the measures that have been implied, the assessment of the effectiveness to be conveyed more regularly to the public, so that we know what has been done so far, and if it's effective according to according to how we deal with COVID and transmission.
Thank you very much, Dr. Giannousi. Any thoughts from any of our other panelists?
So I fully agree. I mean, a better collaboration between healthcare providers and public health authorities and the government is of major importance. Being consistent and trying to communicate, risk versus benefit. But also, I think what I value the most, and this is something actually I realized over time, is how to evoke the right emotions. I mean, also Nicos mentioned that into the public health messages and leaflets, and I think this is something as healthcare providers we should aim for. Just try to evoke the positive emotions to our patients. Listen to their views. Actually, first listen before give any answer, because understanding their views will help you actually communicate your message by using the format or the message that will be mostly appreciated and accepted by the recipient.
Thank you very much, Dr. Ierodiakonou. Any other final thoughts from our panel?
The only final thing that I wanted to say is that, and going back to Andrie's point on consistency of the messages, I agree with Andrie that we should have been transparent to people from the beginning that this is an evolving situation and that we might need to be changing our messages according to what evidence we have. So if people knew from beforehand that this is the case, that we're acting on what best evidence we currently have in our hands, then they might have more trust in us. So transparency was important, and the consistent messaging based on the new evidence. And also going back to Zoe's comment about giving people information about the efficacy of some of the measures. I agree with Zoe. For example, now there's definitely information about, what percentage of the people who are who have had serious illness and had to be hospitalized, or people who died from COVID, what percentages of these people were vaccinated or not, rather than giving information on individuals. So giving that information out, comparing to people who have not been vaccinated, is something that will show the efficacy of the vaccination campaign.
Thank you very much. Since we have about 2 minutes left, maybe, yes, Dr. Middleton, if you wanted to give some quick final thoughts. And I would just ask our other panelists to mute themselves, please.
Yeah, I was going to ask whether it's just my, because I've got a lot of interference in the sound. I agree with all the panelists, but I guess I want to be fair and I want to be optimistic here. Fair in the sense that I'm going to focus on the local level in Cyprus. I don't think as a country, we're a country with either a long tradition in public health communication or a strong tradition in public health communication. So I think the last 15 months have been actually a crash course in health communication. And if we don't self-congratulate ourselves that we did well and we receive lessons for the future, I think there is real optimism that we can do better next time. And by next time, I don't just mean the next epidemic. I mean a lot of public health priorities in this country and how we communicate with the public. And if I had to keep two things, I would agree with my fellow panelists that we need to cultivate a culture of partnerships. This is it felt at times that it was the Ministry of Health and then everybody else was just waiting to hear and judging and criticizing what was right, what was wrong. That's why I said I want to be fair. There wasn't much listening, but there was a lot of talking from partners as well that should be on that side of the table. And I don't want to name these partners. So a culture of partnerships is what we need.
Thank you very much for your final thoughts, and thank you to our panel for participating, obviously, in this conversation. We'd like to just wrap up, understanding that we are right at the end of our conversation today, to acknowledge that our hope today was to highlight the importance of communication along all aspects of health and not just during a pandemic or outbreaks. This is relevant to our clinical and all of our public health work. And we've highlighted how there are some best practices to consider, that really consistency is key, and that requires creating a collaborative environment where really organizations, institutions work together from the clinical and public health realm and all other realms to create a consistent message, to create transparency, and to collaborate to create messages that will help the public by listening to the public and our patients and our community. So our hope for you today is that as students or public health professionals, that you really think about the role that you have to play in the future of communication, reminding ourselves that the future begins now. As Dr. Middleton pointed out, this really is about all aspects of public health and health communication. So think about some of the pieces our esteemed panelists have highlighted and shared with you today. how this will proceed through the rest of your career and in the ways that you can help our patients and our communities to lead their optimal, healthy lives. So thank you very much to our panelists for their time and participation today. To all of you in the audience, there is a feedback form, and I've just shared the link with you all in the chat box. We would truly appreciate your feedback. It's anonymous, so that you can give us some thoughts on how to continue to improve our presentations and on any other thoughts for presentations in the future. I'd also like to take this opportunity to remind you that, as I said at the beginning, this is the first of our presentations for European Public Health Week from the University of Nicosia Medical School. We have presentations throughout the rest of the week, Tuesday through Friday, and you can see the link that I've placed in the chat box where you can find information about the rest of the events for this week, and the registration information. Participation and registration is free, so we welcome and invite you to attend in all of our sessions today. As a reminder, this session it has been recorded, so it will be posted for your perusal if you would like to refer back to it after the presentation is finished, and it will be posted on the University of Nicosia's pages. So thank you very much for joining us today. We truly appreciate you having joined us this evening, particularly for our panelists, but all of you in the audience. We hope to see you in the rest of the sessions during European Public Health Week. Have a wonderful rest of your evening.
Thank you, Maria Cecilia, for being a
Thank you.